Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers with a weekly podcast of the Common Sense MD. June is Men's Health Month, so for those men out there, congratulations. I hope it's a great month for you. I want to talk about a men's health issue that's very important. It's been in the news lately, and everybody thinks about it, worries about it, and that's prostate cancer screening with the PSA, which is a very misunderstood number that men a lot of times worry too much about. I'm going to try to clear that up for you. Men really need to know more about their prostate health, and their doctors need to know more about it as well, and how to advise them on it, because even the doctors really, unless you do a lot of this with men's health, you can't trust some of them, and they just needlessly worry you over nothing or send you to the urology when you really don't need to go. But especially screening for prostate cancer, which is the second leading cause of cancer deaths in men in the United States, right behind lung cancer. About 30 to 35,000 men die of it every year in the United States. Screening is controversial. Look at Joe Biden. This is why this is in the news now. This man should have had the best medical care in the world, yet they missed an advanced metastatic prostate cancer to his bone that will probably result in a painful death. I really wonder, with all the medical problems that he has, did they think he was just too old to matter? His last PSA apparently was drawn at age 72. He's now 82 years old. Technically, according to the recommendations of both the American Academy of Family Practice and the United States Preventative Service Task Force, they recommend stopping PSA checks at age 70. I guess because they think you're going to die within 10 years anyway. To heck with how painful it's going to be. Most screening recommendations are men start screening at 50, 45 if you're an African American, even 40 if you have a really strong family history of prostate cancer. Most recommend levels that are less than 2.5 nanograms per milliliter only need screening every 2 years. If it's greater than 2.5, every year. The American Urologic Association, which sees a lot more prostate problems than anybody, recommends a baseline PSA at age 40. I agree, along with a digital rectal exam, which I agree with, and then another DRE when PSA levels rise. Both the USPSTF and the CDC no longer recommend digital rectal exams. I personally think the DRE is helpful to check for size, nodules, and also rectal cancer screening. It's a bit uncomfortable, and the doctor's not going to be good at it unless they've checked a lot of prostates. So it's up to the patient and the doctor to think about this, but you need to be educated about this. If I get suspicious, I always check the prostate. This whole thing about our advanced healthcare system here in our country missing Joe Biden's metastatic prostate cancer points out our broken healthcare system. It's too cookbook and really based on lifespan, not health span. There are plenty of 70-year-old men who will live past 100 and be healthy into their 90s. You really have to be your own healthcare advocate these days. So let's discuss screening PSAs and some nuances on how to interpret them. Whether or not you start getting your PSA at 45 or 55, here are some rules before getting this blood test. Avoid sexual activity for 48 hours before. Avoid strenuous exercises for 48 hours. Avoid prostate stimulation, including a prostate exam, for 1 week before. If you have a UTI or prostatitis, that's not the time for a PSA screening. And realize that some medications like Proscar, which is finasteride, or Avodart can falsely lower your PSA. As a doctor, I have patients who totally don't want screening of any kind, and that's their right. I respect it. but I do try to give them good advice and discuss the risk with them. So if a PSA is less than 2.5, we can follow it. I prefer yearly. Also remember, if you have prostate problems like urinary frequency, nocturia, which is going to the bathroom a lot at night, blood in the urine, or pain, problems need to be excluded first. Besides the baseline PSA, there are other factors. One is the PSA velocity. In other words, how fast a PSA rises from one year to the next. Because prostate cancer is usually very slow growing. You have time. So the rule is if a PSA increases more than 0.5 a year, you need to, raise a red flag and look further at other things. It doesn't mean you necessarily need a biopsy. It's just you need to look further, and I'll talk about those tests in a minute. Another thing is a PSA density test. And that's a useful tool if you have an enlarged prostate, which can be responsible for a higher PSA. It's calculated by the total PSA, which is divided by the prostate volume. Remember, the larger your prostate, the more PSA it cranks out. However, you have to do a transrectal ultrasound or an MRI to see the volume. I would choose MRI because it can visualize cancer as well. It has to be a special 3T MRI machine. Remember that. So an easier blood test that I do very frequently in my practice, especially if an elevated PSA is between 5 and 10, I use a free PSA percentage. It predicts your lifetime risk of prostate cancer at various levels of your PSA. PSA occurs in two forms in the blood. One form is attached to proteins. That's the bound form. The other form is free, unbound, which is better. It's better to have more free PSA in your blood than bound PSA. So if your free PSA percentage is low, then it's worrisome. So I use this test a lot if the PSA is elevated and the exam is normal. Also, I get a lot of MRIs. I used to have to send my patients to Chattanooga or Atlanta for this. And there are other advanced tests like the PHI and the 4K test, which I can't find and I can't get insurances to cover it. So I use the PSA percentage a lot, especially if you're in that borderline gray area. If you're older, which your PSA is going to go up as you get older, especially if you have BPH, benign prostatic hypertrophy, which I have, and most men my age have it. But if your PSA is consistently greater than 10, you have about a 50% chance of cancer. But I've seen PSA of 2 with cancer, and I've seen PSAs of 18 with no cancer on biopsies. If your MRI is abnormal, there are places to get an MRI-guided biopsy. I like Dr. Bush in Atlanta. I've seen him many patients. Most do an ultrasound-guided biopsy around here, and that's fine too. We've got some good urologists. There's just not enough of them right now. It used to be that anybody with a PSA over 4, you send them for a biopsy. There were many, many needless biopsies done with that rule. I call those the dark ages. It's much better now. And the other thing I'll mention is that when you follow PSAs, if you have cancer, your PSA rarely goes down. It's always elevating if it's cancer. I have a lot of guys that really panic if their PSA is elevated. There's really no need to panic. Just get a better evaluation from a doctor that knows what they're doing. Or get a free PSA percentage, an MRI, see a urologist. There's just a lot of nuances about the screening for prostate cancer. But do the screening. And if you do get a biopsy, don't panic. A lot of low-grade cancers like a Gleason 6 is really, you just do watchful waiting. It's probably not even a cancer. Now, if it's over 7, it's an aggressive cancer. There's a thing called a Gleason scale that's very helpful in determining how aggressive this cancer is. So men, realize all this stuff about your screening. Take control of your own health. These should be the best years of your life. So take care of your prostate, and we'll be talking about this more in the future. I'll see you next week.